All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. I saw in the last talk that Dr. Sameena Chowdhury said that this data is confusing. So, of course, the point of this discussion is to make the data confusing, in my opinion. I may be wrong, but to me, it seems like the data was intentionally confusing. So I can, if she joins us again, I can try to explain it once more. So tell me this, how's everyone? Texas, how are you doing? DDS, how are you doing? John Snyder, hello. Christy Tucker, hello. Lonnie Fellersen, hello. I am Fellerbean, nice name. Kelly Bannon, hello. Texas, good to see someone who already pawed the like button. Yes, paw the like buttons. John Snyder said it was me. Thank you, John. Closet Picker, bonsoir les amis. Good evening, friends. Would that be pronounced as bonsoir les amis? Les amis. Hello, Christy, hello, and lots of folks. Jana, hello, how are you doing? So Texas says, I'm still trying to process. I know it is so upsetting too, Dr. Bean, to even think about. So Texas, are you processing because the data was confusing, or because it is unbelievable that it is written this way? Because if it is confusing, I'll talk about it once more. Back at it, Dr. Bean Medical, you now have 1/3 of a million subscribers. Woohoo! Thank you very much. And actually, generally between Facebook and YouTube, there may be some overlap. We have now crossed 1 million. I think Facebook is about 400,000-500,000, and YouTube has reached 330,000, and then there are some more folks on the site. And again, Roman, when I started, it was not the basic intent, but this is I like it that we are working together. Madeline says, can you talk about breastfeeding and vaccine? So yes, very quickly. Let me actually share my screen. So we have been talking in the beginning that IgG, so G is, it looks like a pregnant belly. And so it is something, it's an antibody that can cross placenta and go to baby and provide immunity. So if the mother, she gets, so if she gets the vaccine will produce IgGs. Those IgGs will go, if it is pregnancy, then the IgGs will go to child through the placenta. And if the mother is breastfeeding, then IgA will go from the milk to the child, and that would provide protection. Child's first few months, the protection is actually by mother, either the antibodies that have been sent over before when the baby is inside the mother from placenta and IgGs mostly, or through the breastfeeding as well. Not or, and if there is breastfeeding, then that too. Scarlett says, I think the pharma is sitting on a lot of data deliberately misleading, and as the vaccine is experimental, so the true results will not be out of a few years. I really think that they should just put the right data out there and let people make the decisions. People are having to make decisions already. There is no leadership offered where one can go and say, yeah, CDC is saying this and this is correct. So just give the data correctly. Colin Hamill says, there have been babies born with COVID who survived. Why bother vaccinating a pregnant patient anyways? So that's a different kind of a question. I think that let's say my family, and somebody is pregnant in my family, and I believe in vaccine, and I think they can take a vaccine. Even then, this data should inform me that, hey, vaccine in the first trimester is not good, so don't do it. That is the kind of information that is useful for people to make decisions. Judy says that we are so fortunate to have you and other superheroes to help us. Thank you very much. And this is, again, we are helping each other. Today's talk, both parts, one part was Neelay Das, and the other part where the koolBeen discussed that, hey, if it was hitting the vein causing the clotting, then this should be happening everywhere, and first jab, second jab, all equal. And that is not happening, which means it is not about the vein, is also a very important point, and was by a koolBeen. DDS says, is this the first study on pregnancy? It's so shocking. DDS, no, it is not the first one. There are studies from Israel as well. However, this is the first study here in the US, and they manipulated the data, which made it shocking. They could have come out and said, you know what? These parents had decided that they wanted to have the vaccine. And here is what we saw, that the first trimester is not a safe area. And we are saying, FDA, CDC, we are saying, hey, during this 3 months period, don't get vaccinated. Be very careful, stay at home, protect the mother, but don't get vaccinated. And 4th month, 5th month, you're okay. Imagine how much trust they would have gotten from people if they came out like that. So Genesislights says, regarding antibody level, is there a correlation or cutoff point of how much? No. The most important cutoff point is the one that is on the test. So when the test is measuring, the test would say, for example, many tests would say 1 micro per milliliter or something, or 1 international unit. That is, below that is non-reactive, and above that and above that is meaning you have good antibodies. Now above that, it is 10 or 20 or 100 or 500, doesn't matter. That simply means that the immune system is working, and they would decide when to work more and when to work less. Cindy says, I saw Cindy's question. Cindy says, do we know if anything from the vax goes to the placenta like it goes to the ovaries? So first, vaccination, lipid nanoparticle can go everywhere. And I should not say lipid nanoparticle. The study that we keep discussing about, that study showed pieces of the particle. And so these fatty pieces can go anywhere. I'm sure that they can cross placenta as well, but placenta has much more control over there. Other things will be maternal antibodies that would go there, nutrition that would go there. I do not know if there any other vaccination pieces would go there other than IgG that is developed that should go. Jenna Taylor says, saw my eye doctor today, right eye lazy, glasses aren't working. I thought it was 5 hours anesthesia, 6 to 16, but he said maybe COVID long haul, about wants me to get brain MRI and optic test. So there can be COVID long haul can cause neurological symptoms, including optic nerve issues. Now, when you say lazy, is it the muscle movement that is incorrect, or is it the focusing that is incorrect? I have heard about the focus disturbance, but not about the muscle movement or eye movement problem. Either way, it can be because of that. Have you tried fluvoxamine, or have you tried other such remedies? If he wants to get the brain MRI, that is fine. That would just tell us more about the pressures and the situation in there. So I would say go get it. And if needed, then please contact me. I have been, so we'll talk about it. Gold, I just saw the question. Drayton Aleo says, I have been dealing with long COVID for 6 months. I recently had my vitamin D checked. It was 15. Sufficient range is 3 to 100. Can this low level be a reason why my symptoms might be worse? So Drayton, very interesting. Yes, it could be, which caused the long COVID. However, you have to check a couple of things. What I'm seeing is in long COVID, when we take a lot of vitamin D, it actually makes the symptoms worse. And giving a break from vitamin D actually makes the patient feel better. So yes, low levels of vitamin D can cause immune dysregulation. However, don't bombard yourself with the vitamin D. If you're taking it, give it a pause for a couple of days and see the response. And if you are going to take it, don't take it like I used to do, 5,000, 10,000, 20,000. Take maybe 1,000, 2,000 units. So Lonnie says, any thoughts on the generation implications of this? There is so much that is not known anymore. Info on second trimester effect. So second trimester, 2 out of 50 something. So that is 4%. It falls within the normal range. Similarly, they have data about the abnormalities or stillbirths or other issues, but these did not seem to be different from the issues that are normally seen. Mary says, which vaccine is this? This is about messenger RNA vaccines. Louis says, does Dr. Tesslaurie have data from her work that reflects on this? Can we put this on the question list for her? Absolutely. So there is a, I'm going to tweet about catching the questions for her, and then we will use this. Coordinating says, Mr. Bean, if a cell that is producing spike protein dies, does that release the S1? It can release all pieces of spike protein, the whole spike protein, or broken up. So yes, whatever is in it is going to be released. Skyfrog. So Skyfrog says, I'm surprised they did not include men in the denominator. It would have reduced the percentage even more. Actually, Skyfrog, they said pregnant persons, not pregnant women. So I'm sure that there were some men in there too. I'm being facetious. Tika says, yes, Queen, my cousin did an antibody test. Her daughter, 2 years old, she was positive for the virus. Two of her uncle were positive, and she got it and positive of the vaccine through breastfeeding. Yes. Art Patron says, we need superheroes. This miscarriage issue is an epic fail for experimental vaccine to be used on pregnant women, as bad as thalidomide, as so FDA does. So I think the information should be provided, and some advisory should be there to say, hey, women under 50, don't take adenovirus. And I'm very upset about this hitting the vein, causing clotting. That may be causing clotting. And as that koolBeen said today as well, that fine, do the aspiration, that would only make it a little more safe. But really, now if you go to Nick, Dr. Nick said, he tweeted at me to say, isn't this going to create now a reasonable doubt? So if somebody goes to the vaccine, although they are indemnified, that means we cannot go and sue them. But if somebody does try to sue them and say, well, this caused clotting, they're going to simply say, look at this study. It said that this could be an intravenous issue, and maybe that is what happened. And all of a sudden, they have a reasonable doubt. And now people would have no recourse. And this is a very, very important thing to think about, that koolBeen said, well, if it is all about intravenous vaccine causing clotting, then why not in men? Why not in children? Why not after the second dose as well? Why just women under 50 first dose? So anyways, there should be advisory like this to say, women under 50 adenovirus, don't take it. Men under 30 messenger RNA vaccines, don't take it. Old age, not old age, I'm 50 as well, so I feel young. So 50 and above, let's say 50 to 60 is okay for Johnson & Johnson, but 60 and above Johnson & Johnson for Alaska and for Native Americans, it's not useful. So if this advisory was given, it would actually create more confidence. people, we can trust them to say, I can go over this chart and see who I am and what suits me the best, and then I can make my decision. And thank you, CDC, FDA, WHO, to give me this chart. They actually think we are that stupid that we cannot do this kind of thinking. D House says, I watched a video on spike proteins getting out of the cell, and now how hard it would be. But now I hear you talk them found around the body. Were you just a little mistaken how easily they get out? No, so I don't say that they get around the body. What I say is, and I used to say that as well, that if a cell is broken, things would come out. And I still say it, that they should be picked up by the immune system nearby or in the lymph node. Having said that, the study had a conjecture, just like intravenous vaccine was a hypothesis. And now all of us are talking about intravenous vaccine. Similarly, that was a hypothesis from the study, that it is possible that the anchor part of the spike protein will not be there and the spike protein will be running around in the body. So no, I'm not in that area. The question I have is, in my mind, is the following. Let's say I have 1 billion spike proteins produced. Is it possible that 1,000 of them or 100,000 of them can escape into the blood and roam around? And what would they do? So that may be possible. But saying that we would just continuously making spike protein, some factory here, and that is bombarding the body with the blood and the spike protein synthesis, I still don't believe that is going to happen. Bilal, New Jersey says, there's a COVID long hauler was prescribed fraxipirine for 5 days and her symptoms were cleared, which it explains vascular clotting. What do you think about this drug for folks that's not medical? So anti-clotting drugs are useful as well as part of the long haul. DLC drummer says, I just started fluvoxamine. Is there anything I should expect? No, it's pretty safe. Again, look at the safety profile of this. It can cause people to feel slightly differently, but most of the patients I'm seeing who are using fluvoxamine, they're fine. So Inspired to Wander says, can we ask for aspiration if you get the job? Yes. And sure, ask for it. Meaning, I'm not sitting here saying don't ask for it. I'm just saying that they are pointing at things which have lesser chance than looking at the vaccine itself and then saying, well, it does something to women under 50. Don't give it to them. Guds Jane says, what are the chances we will get a variant that will evade the prior immunity from vaccine? When the variant becomes a strain. For example, yesterday somebody left a comment under the video, Dr. Mobeen, you don't understand, Delta Plus has become very nearly a strain. So when the variant becomes a strain, meaning when it escapes, then it escapes. So far, there has been no variant that can escape. We are seeing, for example, with Delta, lesser efficacy with the first dose, better efficacy, normal efficacy with the second dose. Plus, we are seeing that Delta is actually not causing too many deaths in vaccinated areas or previously infected people. And that is what you expect. And yes, Pasi's question is comment is very important. Skyfrog, you did make me laugh. So Nazal Islam says, antibody levels at 25,000 AU ml after 2 doses of AstraZeneca, natural infection and repeated exposure to various. What are you doing? So you are naturally infected and hopefully recovered. Then you took AstraZeneca as well. And yet then you're saying, am I immune? I've not contracted it since March 2020, despite repeated exposure. So yeah, you seem to be immune. Much better than us. Colin Hamill says, big pharma are liars in this and other areas. We survived without them before, so why not now? Yeah, we will. But look, vaccine is in their control. And there are going to be people like me who would say, I want to have a vaccine. Then the information given should be correct. Web Access says, had bad reaction in 1990s to third Hep B vaccine. Concerned about constituents I may have reacted to. Was gravely ill for 3 to 4 weeks. Doctor doesn't believe me. Doctors are... Patty says, daughter had mild COVID last year. Okay. Now in second trimester pregnancy. Her doc said she still needs vax. She got it 2 weeks ago. Missed lecture. Got interrupted. Can this harm the baby? So for the second trimester and onwards, there is the harm level is actually the same as not vaccinated standard background stats. It is the first trimester that is more in trouble. So good luck to her. Congratulations. And I think she'll be fine. JLB says, Texas Mag, how are you? Could you give me Dr. Bean's Twitter? I'm going to put that here. It is called Dr. Bean Medical Lectures. So let me show you. I usually do not promote my own these things, but here my Twitter is Dr. Bean Medical. So Dr. Bean _ medical. Dr. Bean _ medical. So Madeline says, I'm confused about whether breast milk from a vaccinated person is safe for the baby. Yes, it is. It actually has IgA, which is very, very protective of the mucous membranes. It would actually protect the baby. John Ria says, and do they take PayPal or Bitcoin? I think Buy Me a Coffee takes PayPal as well. I do not know about the Bitcoin. If you're talking about me, if it is something else, then sorry. Blank says, I am 51 and I'm required to take the vaccine. I received the first Pfizer vaccine 7 weeks ago. Can I ask a doctor for some protective medication ahead of the second dose? Yes, you can, but I do not know if the doctor would agree or not. Your age is like mine. A risk of the vaccine side effect is slightly less, but still at least over-the-counter anti-inflammatory, anti-allergies can be helpful. At least that's what I did for myself. Guds Jane says, I have a mark on my arm where the vaccine went. Does this mean blood pulled out? I'm the only one in the family. That means that there may be bleeding, there may be inflammation causing bleeding. Don't worry too much. Westfield says, in the UK, the cases are now 16K, average from 3K a month ago, but deaths is still lesser than 20 for over a month. Yes, and that is expected. People are vaccinated, plus people have been infected and recovered. I'm sure that there is asymptomatic folks as well that are part of the herd. The remaining people are younger, they are healthier. The chances for severe disease in them are lesser anyways. So it is expected. Luis Grande says, can we trust verse at all? So do doctors report patient adverse? To an extent, yes. At least it gives you an idea of what is going on. They don't have the right numbers in there, but at least it tells you how the numbers are looking. So, Dr. Bean, are you aware of the New England Journal of Medicine study that stated 700 women who were vaccinated in their third trimester had spontaneous abortion? I can link to the study. That's what we just discussed before. So 827 women, out of them 700 in third trimester. Third trimester were fine. The 127 that were in the first trimester, out of them 94 had spontaneous abortions. Very high number, 82%. JLB says I'm not used to Twitter. No worries. Bilal says, Dr. V, let's say those 5,000 spike protein got into your body. What is the possibility of damage? So these folks have made spike proteins somehow as if every spike protein is some sort of a poison shot. When we get sick with the virus, actual virus, the virus makes many, many more spike proteins and they run around much more, and the virus travels around in the body as well and goes to various parts. And what happens? Majority of us stay okay. So if a tiny bit of spike protein is produced, majority of that is broken down, shredded, presented, eaten up by the macrophages, immune system reacting to that. Some of that escapes, so what? So let's say 5,000 spike proteins, as you said, are in the blood. They will attach probably all of them to one cell. We'll have thousands and thousands of ACE2s on cells. Or let's say just one spike on one ACE2 on one cell and 5,000 cells. And we have millions and millions of cells. So let's up your game and say, instead of 5,000, we have 5 million spike proteins. 5 million spike proteins, what are they going to do? Do we not get infections and we control them and we take care of them? So this is just, I don't know why people just continue to, and by people, I don't mean the cool beans here. I mean the folks who we trust to say, I trust this guy. He's a Nobel laureate or he's a immunologist or virologist. And then they come in and do such talks. Texas says, I've been barred from Twitter, so I'm not a very good authority. Many people are getting barred from these places. Skyfrog says, I dropped my Facebook and Twitter accounts. I was going to draw my YouTube account, but then I'll miss these videos. I need to seriously get off of YouTube and go somewhere else. I tried to go to BitChute, but as soon as I started putting my videos there, BitChute actually shadow banned me. So it became very difficult to find my videos. My channel would not even appear, even if you searched it by name. And not only they shadow banned me, then it became so difficult to upload there that there were just so many things to do that I just left it alone. LL Hannah says, does natural immunity protect well even if the person was asymptomatic when they had it? Yes. So asymptomatic means that you were even better protected with the actual infection. Why are you afraid for the second one then? Your body handled it like, I don't even care. So yeah, you're fine. Cupid says, question, I have low adipose tissue. Could vaccine needle hit the bone? Last vaccine was for TB9 but had more muscle fat. The nurses are trained to look at your body mass and then decide what needle to use. They have different lengths and bore. Number one. Number two, there are specific methods to create mass and then inject in that. So there is a Z-roll method. And so nurses are not just that. Accidents can happen, but they're not that naive that they do not know how to inject in a person with less mass, more fat, less fat, and so on. So you'll be fine. Medical student says, sir, why my muscle is paining over vaccinated area? So this would happen for a few days, and that is okay because there is local inflammation. You're very welcome. Cupid said, thank you. I heard Rumble isn't live. Yeah, so that is another. There are solutions. You're welcome. There are solutions which allow you to be live on your own site. I just have to figure it out. Jen says, how about Rumble? I like Rumble. The thing that I liked about Rumble was somebody was stealing my videos and uploading them on Rumble. And I reached out to Rumble and I said, hey, this is my video that this person uploaded. They, within 10 minutes, removed it and sent me a message saying removed. That was just some very fast service. Swan Moon says, Dr. Been, I'm very sensitive to any pharmaceuticals. I have to cut them in quarters. Would this be the same with vaccine? I am hetero. So do you have the same problem with injections as well? The only place, for example, as we are seeing, the issues with the vaccines are going to be people who have severe allergies or people who are allergic to the components of the vaccine itself, or people who are, let's say, in the first trimester, or women under age of 50 taking adenovirus, or men under the age of 30 taking messenger RNA, and so on. So these are the known risks. Bilal New Jersey says, sorry if my question wasn't that good. Your questions, all questions are good, but you have to know I love you. Thank you very much. Love you too. Art Patron says Rumble may be better. I think I should try Rumble. Rumble I haven't tried. Shocking about censors. Yeah, they're censoring everyone. Cindy Glasgow said the problem is that within most OBGYN offices, the number of fetal losses, especially first trimester, will not be high enough for the doctor to notice. Tell the patient that it can't be the vax. Yeah, so they'll not notice and they'll just say, yeah, it's not vax, it's just, it happens. Yeah, you're correct. But this is where education comes in, that these numbers, even in this paper, I am surprised that they tried to put the spontaneous abortions, and in the denominator, they use a third trimester vaccination count to add to first one. MSNBC said, when you were using ivermectin prophylactically, were you in direct contact with patients with COVID-19? I'm just wondering about protection. No. My practice was all over the video. Colin says, banned from Facebook and Twitter over a year ago for mentioning ivermectin. And I might get banned soon as well, but so far, some folks come in and say, you are still not banned, you are in cahoots with them, you have something to do with them, which I'm not. Then some folks say, well, you have this black over there, that means you have something to do with YouTube. Pia says, Dr. Been, I had 2 doses of Sinovac Coronavac. Can I get a better vaccine like Moderna after 3 months? Take 1 dose and then see the side effects. Don't take both close together. I think that these vaccines are fine as well. If I was you, I would get my antibody tested, my T cell tested before I take more vaccines. The Scorpion, she says, I was forced to take Pfizer because my mother passed away overseas. Sorry about that. And I had to travel. Once I returned back, do you advise taking the second shot? They say the side effects can be dangerous. So that is where I can tell. I do not know your age. I do not know your comorbidities. I do not know your gender. My children have them. They took vaccines, both. My son, younger son, he had 1 dose, and on 7th, he has a second dose, and I'll go with him and he'll get it. IV injection was a hypothesis. What made it possibility now? Nothing. That's what I was saying. It's still a hypothesis. And actually even more impossible. But people start talking about these things. So what happens is, when some study like this comes out, where the author themselves are saying, hey, this is in mice, one, and number two, the behavior of the platelet in mice is very different from humans. And I can actually very simply look at that mechanism and say, the mechanism that you are using to say that spleen, the activated platelet will go to spleen and the macrophages will break it down and then will create antibodies against the platelet, that actually is the other way around. And that is, we made the antibodies that attack the platelet. Those complexes, when they were passing through the spleen captured them and destroyed them. That is a function of the spleen. So it's just, and then we all get confused. Ashley says, Stephen Kerr said Prozac is an alternative to fluvoxamine. I'll have to look at the mechanism. I don't think that Prozac is sigma-1 as well, but maybe. Lonnie says, would you please consider staying? I stumbled across your channel and it has been great. There may be many here. So Lonnie, if I get banned, then you'll have to find me on Rumble or some other place. Barbara says, the censorship of scientific inquiry is outrageous. Yes. Jody, you're correct. He did not say that everyone would die in 2 years. That was an incorrect attribution. And funny that when I discussed about him, I said it, that this part of the news is not him. So Nick says, yes, Prozac is also sigma-1 agonist, but weaker. Got it. Coordinating, Dr. Bean, is there a risk of transfection with the J&J and AstraZeneca adenovirus vaccines? No. No. The Weinsteins moved over to Odesi, so maybe I'll have to do something like that too. I'm going to hang out here as long as I can, and when they take me down, then I'll go somewhere else. Hopefully, we'll just have the pandemic over. We'll learn a lesson not to trust these folks, and then hopefully in the future do better. TD says, can you start a new tube, please? So there's a new tube as well. Okay. Jen, I think you are correct, Jen. I think it's disgusting that they're trying to obfuscate the data. I think they are afraid of vaccine hesitancy. I think so too. So to me, it's not some malicious, evil thing that they want to kill babies. I think they're trying to hide it or obfuscate, as you said, just so that people don't develop hesitancy and they can continue to have the vaccine. The problem is, excuse me, it is actually fair to say, for these 3 months, please don't have it. We all have, spouses, partners. Majority of us, we came from parents, and many of us are parents. So it's not about politics or anything. It's about human beings. JLB says, a woman with 2 doses of Astra should stop with anticonceptionals for a while just after each dose. Contraceptives you're talking about, why? They can continue with that. Sameena says, which one had more abortions, spontaneous, non-COVID, COVID positive, and COVID vaccine will clear out? Okay, so Sameena, let's look at that data once more. I was waiting for your question. So, so let's say we go here to the data. What they're showing is, so I'm going to show you 2 tables. They are 2 separate tables from 2 separate systems. So let's look at these tables. Here, this is a table which has data of pregnant women from VERS. VERS is vaccine after effects reporting system. Here what they are saying is, in this data, imagine it's a separate piece of data. And what they're saying is, there were 81 women who were vaccinated in the first trimester. Good. So I'm looking at your question, which one had more abortion? Spontaneous, non-COVID. So this is not COVID, this is just the vaccine. The data that I do not have here is what happens in the first trimester if woman gets COVID. That data I do not have here. I'll have to look it up. At this time, the only data that I have in front of us is vaccination and pregnancy. So first trimester, 81 women or persons were pregnant who got vaccine in the first trimester. Out of these 81, 37 had spontaneous abortion. So that's 45-46% abortion. This percent of abortion is abnormal, or miscarriage is abnormal, because the normal miscarriage rate in the first trimester, although it is high, but it is within 10 to 15, at least for the US. It may be different for other countries. So where 10 to 15% may have miscarriage in the first trimester, here, those women who got vaccinated, their miscarriage rate was double in the first trimester. In the second trimester, 53 women reported that I'm in second trimester and I have taken the vaccine. Out of those, 2 reported miscarriages. That is about 3-point-some%. Near 4, right? So 2 out of 53, so about 4. The normal miscarriage rate in second trimester is 1 to 5%. So this 4 falls within this percentage. So the women who were in second trimester and got a vaccine, they didn't have any additional issue. And the third trimester is not reported. So what is the conclusion of this table? Women who are vaccinated and they are in first trimester, they have a higher risk of miscarriage. This is one data point. Is there any comparison to COVID here? No, I can actually look it up right now. But let me show you the other table as well before we go to the COVID data. So the other data point is from VSafe. VSafe is another system that is more for pregnancy. And here, this is that table. So this is a different reporting system from which this data is pulled. So here is this data. This is table number 4. The link is in the previous video's description. In here, what they're saying is, so totally different data point. Forget about the other table now. We have gotten a conclusion from there. Here, what they're saying is 827 women were given vaccine when they were pregnant. Out of 827, 700 were in their third trimester and they got the vaccine. And they all had live birth, no issues. First trimester, there were 127 women who got the vaccine. Out of them, 104 had spontaneous abortion. I want to use the correct term. That is why I was looking there. Spontaneous abortion. 104 out of 127. That is about 82%. So if a woman, so this data is saying, if a woman in her first trimester gets a vaccine, messenger RNA vaccine, then her chances of abortion are very high, 83% aborted. This is the data. The confusion they created was they deliberately, I think deliberately, if they come back and they say, no, this was actually mobeen is wrong in understanding this data, then fine. Or they said this was a mistake, then fine. I don't think it is a mistake. Me may be wrong in understanding the data, maybe, but I still would be surprised that why would you take third trimester data, apply it to the deaths in the first trimester, which is different. So if you see here, what they did was it took 104. These were the spontaneous abortions in the first trimester patients, pregnant persons. And the denominator is 827, which should have been 127, because it is showing the spontaneous abortions for the women who received the vaccine in their first trimester and had the abortion in the first trimester. A woman who is in third trimester and receives a vaccine cannot abort in the first trimester anymore. She's already in the third trimester. So that is the strange part. Now the second part of your, I hope this much is clear. Now if you see what is the COVID, let's see if I can find that. COVID caused miscarriage in first trimester. So this is, again, I do not know how good, bad this is. I'm just Googling in front of you and looking at it. Miscarriage risk in COVID-19 infection. So this is August 15. This is August 15, and they are saying, dear editor, first reported August, this is August 15, 2020, last year. Of course, this year's August is not here yet. If you give me 1 second, my son is calling me. I want to just make sure that I can. I'm going to mute you just for 1 second. Okay, so he's okay. I'll call him back. Okay, so we would like to highlight 2 cases of first trimester miscarriage in COVID-19 infected pregnant mothers. So they have 2 cases here. We want to see the percentage. Let's see if there is any data here. COVID-19 and early pregnancy loss. Is there a link? So this is Italy, 22 and May 21. Pregnant women in their first trimester. Results. Case group 100 women, control 125. Overall positive test rate 10.2%. So they had 100 women that were 10.2% positive, well, 10 positive, hopefully. There were no cases of pneumonia symptoms, no difference in COVID incidence. So COVID-19 was not an independent predictor of early pregnancy loss. Odds ratio was 1.28. Conclusion, COVID-19 does not appear to be associated with early pregnancy loss in the first trimester. So that is, now how good is the quality of this study and the authors, I do not know. But this is one link that shows that the study shows that the COVID in first trimester itself is not associated with extra risk of loss. If we take it on the face value, that means COVID in the first trimester does not cause the issues. Vaccine in the first trimester caused a lot of issues. That's how this data looks like. Now, let's see, maybe there is some other data point as well that So this one says, small study identifies placental abnormalities in pregnant women. It's the first organ to form and it does not have a lot of function. Fetus, this is someone miscarried, highest risk of causing injury to fetus in the first trimester. So let's look at it. It seems like news. And news sometimes overreact. A small these cookie messages are because of Europe's laws. Okay, a small study of pregnant women who were diagnosed with COVID-19 found that these women had placental abnormalities that can be associated with adverse outcomes. Studies published in American Journal of Clinical Pathology, 16 women, so it is small. March 18, what did they find? Researchers determined that pregnant women with COVID-19 were more likely than controls to have at least one feature of maternal vascular malperfusion. Okay, so that is some possibility of incorrect perfusion. This is CDC. What do you think CDC would say? CDC would say it is evolving data. We do not know yet. Let's see. Based on what is their date here? May 13, 2021. Based on what is known at this time, pregnant and recently pregnant women are at an increased risk of severe illness of COVID compared to non-pregnant women. Additionally, pregnant women with COVID-19 are at an increased risk of preterm birth and might have an increased risk of other adverse pregnancy outcomes. Okay, so let's see what studies they used. So if I go to the bottom of this one, additional resources, pregnancy and pregnant people, COVID. So they don't have the study here. So they don't have the studies. Previously, they used to list out the studies at the bottom to say, here are the studies based on which we're doing it. They don't have it. So CDC is not helpful. So Sameena, I do not know exactly what is the situation with the first term and COVID. This tiny one study shows that it may be, the risk may not be high. CDC says it is high. I need to do some more digging, but at least with the vaccine, we are seeing the risk is there. Does that help? Okay. Let's see. Roman says, question for koolBeen. Okay. How many of you work indoors with others daily and interact in close proximity with others? Do you still wear masks? Good question. Amy says, I heard a doc say that because kids have a thymus, that they are buffer and won't transmit. No, not at all. I hope we didn't say that. Which doctor said that? This is not possible. So thymus is a gland over here in this area. And yes, it is attritioned in the in adults, but still the T cell training occurs somewhere. So there is some function, I think, that is retained. But thymus and transmission are two very different things. That's a very strange connection to make. Coordinating says, thank you for answering questions. It is greatly appreciated. Is there a potential for T cells that recognize the spike proteins to kill cells creating spike proteins? Is there a potential for T cells that recognize the spike protein to kill cells creating spike protein? Yes, they should do that and they will do that. Yes. So I know your next question, that if a cell, our body cell, makes spike protein and presents it, will the T cell kill it? Yes, they'll kill it. Scorpion C says, Dr. Bean, and I should add, if the virus does it too, our cells are going to kill the cells that exhibit virus proteins too. Dr. Bean, a male and 47, first Pfizer shot only gave me a sore arm for 2 days. Not sure if I should take the second shot. Why in Canada they now recommending mixing different vaccines, didn't before. So they are mixing it for women, especially those who have taken adenovirus-based vaccine. They're saying, well, don't take adenovirus-based vaccine, take messenger RNA vaccine, which is the right thing to do for women under 50 years of age. And this is what our CDC said, we don't want to do it because it will be very hard to articulate or communicate. Rondon says, we have vaccines today, but by the end of the year, we'll have molnupiravir, yes, ivactocil, Novavax. What is your vision about the future treatment or jabs every year? So I think that we will get out of the coronavirus because we will develop immunity for 2 to 3 years. So we will not get this virus. It is possible that, let's say, because this variant SARS-CoV-2 is developing in us for the first time, and it has 7 billion possibilities to change. So it may actually change. But if you think about it, the possibilities are reducing as well. So even if it creates a new variant, that variant would have less people to go to because majority are going to be either infected and recovered or vaccinated and recovered or asymptomatically recovered. So it is going to have less and less opportunity to survive. And coronaviruses generally do not variate very fast or mutate very fast because of their proofreaders. Those folks who say, well, don't you see there are variants? That is, variants occur everywhere. But the speed of variation, coronaviruses don't have speed of variation like flu virus or other viruses. And because of that, we would luck out, and I think we'll be out. Maybe there will be one more time we'll be given a booster to say, hey, there is a more dangerous variant, but I think that will be about it. Now, molnupiravir, ivactocil, these are big pharma games, and molnupiravir, I think, is going to become a drug, oral drug for everyone, and people will take it because it is an oral drug. You stay at home, you just take it, and you don't have to go for vaccine and everything. So I think it will become prevalent. John Riaz says, can you establish a koolBeen-generated registry that we all can simply submit anonymously our own doctors' names, either under Hippo-Doctors or Zippo-Doctors name share? Sure. We can have a Discord channel with hippos and zippos. Rondon says, thank you. You're the best. You're the best. We are all together the best. Jay Berton says, should my 15 and 17-year-old kids get the shot? They want it so they don't have to wear the mask. This is a very difficult question for me. I have for 15 months not been able to answer these questions for children. A slight ease in this question is from latest CDC's behavior and the data. The data shows that children's vaccination is about 9% of overall vaccination, but 53% of the children are developing cardiac issues, or not that. Out of all the cardiac issues, 53% are in this population that gets vaccinated. So from that point of view, it is a risky thing to do. Having said that, I totally understand that a child with a mask all the time on their face is going to be annoyed. They are free spirits. It's time for them to run around, have fun, enjoy, and mask is a problem in that way. So decision is yours. I cannot help with that decision. My children are older, so it was okay for me. One is 27, one is 23. They both have the vaccine. One has his second dose on, I believe, 7th July. 7th July. And I am okay with that. Robert says, I'm a 60-year-old healthy male that was hospitalized in May with COVID. I have recovered well, except for a high heart rate. Is this common? How long should I expect this symptom to last? So that is a long haul symptom. I know some patients who continue to have high heart rate for a year, but they also did not have a lot of medicines available because they were in UK. And then when the medicines did become available, they are very quickly recovering. Similarly, I know a patient here in the US who developed a high heart rate, but as soon as my long haul protocol was given to her, she started recovering and no more tachycardia. Within 2 or 3 days, she recovered from that. So it really depends upon the medicines and your management of it. I think if you don't do anything, it would continue to recover, but it would take a long time. But if you get ahead of this fast, go to flccc.net, and over there, I Recover protocol is present. Look at that protocol, talk with your doctor, and that would help. So Amy says, I heard a doc say that because kids have thymus. So I just responded to that, Amy, that it's not a correct message. So Bot OP says, is there any data on post-vaccine long COVID? Not data, but we are seeing lots of patients with that. I'm sure data will become available too. The Scorpion C says, how can we achieve herd immunity unless 85 to 90% population are fully vaccinated? When we have 45% population vaccine deniers or vaccine hesitants, it will be tough to do. So in the case of corona, so first I agree, I understand what you're saying. And there is also the percentage of people needed to be protected or immune to develop herd immunity. That goalpost has been moving. Remember, originally the R naught was supposed to be 2 to 3, and then the herd immunity need is R naught minus 1 divided by R naught, and that was 1 minus R naught divided by R naught, and that was about 66 to 74%. And now we are saying 80%, 90%, 100%. So that is one, that it is moving, the goal. Second, I think it is not going to be possible to achieve that with vaccine everywhere because there are going to be people not taking a vaccine. Fortunately, there are going to be youngsters who will be better protected. There are going to be children. There are going to be adults who can asymptomatically handle it. So there is a slice of the population that would handle it in a lesser severe way, and they would become part of this herd as well. But you're correct. And I do not know what is the right answer. I think if I was, let's say, running CDC, and I looked at this situation and I wanted people to take vaccine, what I will do is I will come out with all the data and I would actually make it digestible with my cartoons maybe to say, look, we see the first trimester there is a problem. Look, we see that adenovirus is causing a problem for women under 50. Look, here is the men with messenger RNA, there is a problem. And then I would say, hey, women under 50, don't take adenovirus, take messenger RNA. Hey, men under 30, don't take messenger RNA, take adenovirus. Or let's say children, keep them as protected and safe as possible, only the one with the comorbidities who are at high risk, maybe just have them vaccinated. I will say, hey, physicians, let's have a discussion. And if you are going to have a patient who you're going to give vaccine and that can cause clotting, here is your way of managing that. Here are the tests to run from the day one of the vaccination. So when you would do this, people would develop trust and say, these guys know what they're doing and we can trust them. And now if they say, take a vaccine, I can trust and take the vaccine. The problem is when you see data. So this person here, this, what is her name or his name? I'm going to go to the top of this paper. This name is very common name because it is in FDA debriefs. Tom T. Shimabukuro, MD. This person's name is all over the presentations from FDA. And when you see such folks' papers trying to obfuscate, then the trust which was there is gone as well. It is eroded instead of developing. So I think that is a basic problem. This is not people's fault. This is the leadership's fault. This is like a child who's trying to hide something and that they have chocolate all over their face and they're still saying, I didn't eat the chocolate. This is what they're doing. Just very, very immature way of handling it. Alex says, Brett Weinstein showed an actuarial study about Israel that Pfizer vaccine kills 2 or 3 for 3 saved. Likely means kills 2 healthy for 3 unhealthy. I have to look at the study. I don't think that is the case, but I have to look at the study to say. Genesislights says, Dr. BBC, yeah, let's go. The point is that they could have developed this. This was their opportunity to come close to people and do this thing, this communication with them, and nobody would have stopped them. We were all ears. The whole planet is listening. All the budget could be used on the communication and nobody would stop them. Because let's say the president comes around and says, why are you spending so much money on these stalls and communications? They would say, we are in a pandemic, we need it. No scientist would stop them. No doctor would stop them. Everybody would appreciate it. The whole world would appreciate it. And they're running around like thieves. Can you draw the giant with chocolate? Yes, I can. I don't know if you have watched that little dog on YouTube where it had chewed away the whole things and then the human comes back and says, who did it? And the dog is just kind of looking all over the place. So sometimes it feels like that. But CDC is not that cute. Coordinating says, do you know if the spike proteins can damage the FUS gene and mutate is the FUS gene some sort of a curse word gene? And TDP43? No, I do not. I'll have to look it up. Mindophone. Yes, you've nailed it, Dr. Been. Oh, yes. And how much of a problem? I mean, look at this. Where have they reached? Fauci says, I am the science. If they deny me, they're denying the science. This is how bad it has become. Mehdi says, what is booster dose? Is it needed for vaccine? So far, there is no dose needed for booster because no vaccine has given any extra efficacy or reduced the efficacy or changed the vaccine shape to some new variant that is more dangerous and more the vaccines are less efficacious. So I don't think there is a need for booster at this time. So Louis Grant says, someone on here was asking about DNA vaccine, like one being developed in India. Can we look at this maybe next week? So is this about the inactivated virus? If that is the case, I have done it. Otherwise, I'll look up. Kimberly says, I don't recall saying anything was heartbreaking. I was upset simply due to not being allowed to discuss it, even like due to having emotional illness. I'm sorry, Kimberly, I didn't catch. Barbara says, I love your candor and honesty, Dr. Bean. Thank you. But Barbara, tell me this, isn't this the way to go? I thought that this pandemic is an exceptional state. Never have we all humans come together for so much time, 15 months now. We never came together like this for cancers or for other diseases, for diabetes. I believe if we came together like this for different things, we would have solved them. And with all of this attention and I'll give you an example. I think of that example so many times. Um, there was a time when Britain invaded um, Indian continent, right? So as part of that invasion, of course, there was a lot of brutal history that was created so that they could rule the people. So majority of course, there is a lot of love in India and Pakistan for Britain, but at the same time, in the history, there is a lot of dislike as well for what they did. However, in Pakistan, there is a city. The city's name is Jacobabad. And over there is a grave. And people go to that grave as if it is the grave of a saint. And that Jacob was actually a British army man who was ruling that city, or was the administrator of that city, and was so kind to people that the people who were, if you ask generally from a historical point of view, people were quite oppressed and there was lots of brutality. However, they named their city after that person, and even now when he is dead and gone, even now people go and pray for him. So those who care become immortal with people, regardless of who they are, enemy or friends. So here, this was the best time for CDCs and FDAs and WHOs to connect with people and become their heroes. And they just threw it all away. Okay, so Kimberly says, it's okay, Dr. Me, I was referring to my husband, not you. You haven't done anything wrong. I hope that everything is okay. Christopher says, respect to you, doctor. My question is, after the AstraZeneca vaccine, I developed some cold sore in my mouth. Do you think it's something normal? Cold sore on your mouth. So we have seen that the vaccine sometimes can cause activation of the viruses. So please talk with your doctor and see if it is some viral activation. Ideally, it should go away, but still talk with your doctor. You may need antivirals. Adnan says, can I take Pfizer 1 or 2 shot after 6 months of Sinopharm vaccine? Pfizer 1 or 2 shots after 6 months. Yes, nobody is going to stop you. I always tell those who are in my patient group or my friends and families to say, maybe a better way is to get your antibody tests done to see, do you have antibodies or do you have T cells? And if that is the case, then you don't need it. But if you don't have it, which is possible that you have the immunity, but you still don't have it, then maybe you want to do it just for your own comfort. I usually think that 1 dose may be enough. Okay. Celtic says, Any thoughts on nitric oxide nasal spray? So we actually talked about it. There is a video. I did that. I love this idea. And I think they are, at least the one from India, from Canada, they are approved in UK and Israel. So that's a good one. W Tang says, Dr. Bean, our startup has 99.7% respirator for normal people. Would you be willing to try it? Yeah, yes. Let's see what happens. I try all these things. Hence, is there danger for unvaccinated parents being with unvaccinated 25-year-old children regarding asymptomatic transmission of the virus? There is a danger if the child is going out and may come back with the virus and they may give it to their parents. Yes, that is possibility. It can be other way around as well. But yes. So MSNBC says, do antibody tests given at a hospital lab render a titer, yes, no, or titer? So you can ask them. There are some tests that are rapid, and they would do yes, no. And then there are some tests that would come back with a number. Okay, so you answer my question now. Can I take Monday off? So is it okay if we meet on Tuesday? So that is my question. So the DJ of choice says, why is a death 28 days after a positive test called a COVID death, yet another death 28 days after a vaccine, not a vaccine death? Yeah, so correct question. And again, this may be something to do with trying to create data in a way that is palatable. Coordinating says, last question, are the anti-inflammatory macrophages, M2, inhibited by anti-spike antibodies? So whenever there is going to be antibodies coating something or complement coating something, this is called opsonization, or any cell presenting antigens, then the macrophages, many of them would convert to M1. There is possible that the M2 convert to M1 as well, but in an area of infection, there are going to be many M2s that are just doing repair. This is like an active zone of war where there are some soldiers and some helping things that are cleaning up the area while others are fighting. So you're going to find M1 and M2. If you take an M2 and expose it to interferons plus antibodies plus C3b, for example, the opsonins, it would immediately convert to a fighter and start fighting. So it's more of an immune mechanism than something to do with the spike protein. Another antibody for some other thing, another opsonin would do the same. Okay, Diane says, I give you permission to take Monday off if you answer my question. Okay, where is your question? You should have put the question here as well. Benjamin says, why not take Monday off? You're in control of this channel. We decide these things together. So Jen, thank you very much. Kimberly says, if you get a lot of inflammatory issues in your body and are suffering illness right now, when I do get vaccinated, should I take, and is it said to take an ibuprofen before, needle, and after? Yes. These over-the-counter drugs do not, although, for example, when we went for vaccination for my wife, I had already started her on anti-allergies, anti-inflammatory, anti-clotting. And when we went there and the nurse who was going to give her a jab said, or the the person at the table before said, are you taking any medicines? And I sheepishly said, yeah, I have started her on some medicines. And they said, well, you shouldn't have done that. But oh well, let's give you a jab anyways. So this really is up to you. But I did that for my family. Thank you, Colin. Louis says, okay, so that would allow you to do some studies. So Genesis says, Dr. Bean, could you talk about your other inventions, a break from COVID talk? Absolutely. I would love to. I was thinking of two things. There have been a lot of people who've been asking that, how do I work on this software? How do I use it to draw and present? So I was thinking of actually doing a talk about how to use Made with Mischief, this software. And if you would like, we can talk about my other inventions as well. Kelly, thank you. Cool. So with this then, I'm just seeing. Jerry says, ivermectin protect efficacious U 74%, meta-analysis 86%, Dr. Corey Weinstein near perfect if used weekly, correct? What was treatment protocol in study showing 74? So the 74 was Egyptian study. They had day one and day 3, and that's it for a month. And there was more studies like that which had similar efficacy. And so meta-analysis can say 86% because they're going to be studies with the higher one. I always quote the lower side, not to diss ivermectin. I love ivermectin, but to kind of make sure that we don't start saying, you know what, I'm totally now protected and I should not have a mask or a distance or become too careless. There are studies which only showed 74. So we should just look at that bracket. I didn't see Doug today. So celebrate, enjoy your family. You do not need to talk to us on the 4th of July. We should spend time on our families. Absolutely. Have fun, enjoy. We used to go here near San Francisco to see fireworks. We'll see if these are still on this year. Yes, Luffy is in agreement. Cool. All right, so let's wrap up for today. So MSNBC says, what is your confidence of ivermectin truly working as a prophylactic? No vaccine taken. So yeah, at least 74% efficacy. So see, this is at least this much. It may be better for some. Inspire says, why did your wife get J&J and you got Moderna? So this was, at that time, we didn't have the choice. So we went in with for my wife, and she got a time before me. So she went in, I was with her. We went and we asked, what is the vaccine? They said J&J. And so that is how she got J&J. When I went in there, they said Moderna, and I was fine. I liked Moderna. I like Novavax the most, but then Moderna is fine as well. Cool. So happy 4th to everyone. Luffy has started calling his people and singing the songs of his people. Happy 4th. Stay safe and happy and healthy. Relax, enjoy, and I would see you on Tuesday. And if you would like to, please like, subscribe, and share. That helps this channel. We'll see if my talking would bring it down, but generally it helps it. And if you would like to support this work, there are links in the description to either support it with PayPal or buy me a coffee or be a patron. And thanks to everyone who is a patron. Thank you very much. And I would see you on Tuesday. Happy 4th. Bye-bye.